is put a central line, you will really feel good. And when those patients attenders will come and hug you, touch your feet, cry, you will be like so much emotionally, you'll be like so much touched. Your heart will be touched. Like, this is the thing why I did MBBS, to save lives. You'll have that feeling definitely. Every day, not one day, every day. But these three incidents.
Hello everyone, and today we have Dr. Shrimati Narayan. She is passed out from Edinburgh State Medical University. So, ma'am, please give your brief introduction.
Hi, Chitrali. How are you?
I'm good, ma'am.
Uh,
After that, how are
yeah,
you?
myself, I'm yeah, I'm fine, thank you. And I'm Dr. Shrimati. I am a alumni of Orenburg State Medical University. I passed out in the year 2020, June, and right now I'm working as a doctor in AIG Hospital, Gachibowli, that is Asian Institute of Gastroenterology. And I have given my FMG in the same year, 2020 December session.
Mhm. Okay, so let's start. The first question is, you cleared your FMG examination. So, firstly, congratulations. And then, first
Thank you.
question is, what strategies you use to pass your examination, and which sources you use, and exactly when you started preparing? Like from first year, no one starts preparing. So, which exact year you started preparing for your examination?
Okay. Actually, the thing is, from first year to sixth year, I I just coped up with the college. Means I prepared for college exams mainly
Mm-hmm.
because during our time there was no such sources like PrepLadder, Marrow, like how you guys are having right now. We used to
Exactly.
follow few small YouTube channels, and we used to learn things like video explanation. We used to get sources from YouTube, and we used to study from books, to be frank. We used to study from books from first year to sixth year. So how I coped up was, first 6 years I concentrated on my exam, and I went home July, I think July, mid of July, I went home during this COVID crisis, and I just joined and missed
Okay.
coaching center. And during our time lockdown was there, so everything was live classes, online live classes only. Not even recorded
Okay.
was available during our time because we were the first COVID batch. So online live classes were there from July 15th to November end. We had classes, revisions and all. I just cut myself off from the world. Like, I just uninstalled my Instagram, Facebook, and all social
Okay.
media, and not much active in WhatsApp. And I think that helped me. Means overall, with my basics, missed team and all the faculties, their classes. It helped me in clearing my exam. I got around 207 out of 300 I got. But for
Okay.
upcoming people, what I would suggest is, please take some Marrow or Prepladder and study from the starting. Maybe they will have more
Okay.
strong basics than us, because these apps are covering almost all the books which we should study separately, understand, make notes. These apps, I have used these apps, so I'm telling. Or you can get mixed up.
Okay.
Whatever, whichever you're comfortable, you can just go for it.
So, in which year you started your preparation? Like in fifth year or fourth year,
Uh,
or it was
which
it topper throughout this all 6 years?
No, I started from sixth year only, to be frank.
Okay, okay. So, which
Uh,
books you preferred for your preparations?
for my Basically, for each subject there will be special authors. During my college years, we used to study from them only. Like for medicine, Harrison Davidson is like
Oh,
two eyes. We prepared
mm,
from them only. BD Chaurasha for anatomy. Our previous textbook also, from which our college library offers. No, it's good. And Vasudevan for biochemistry, all famous books only we studied. Our teachers themselves, they referred such books only. Then, if you take for FMGE, the books which I prepared, first is MIST, and some subjects I referred PLAB, and the third thing is Deepak Marwa book. Full previous year MCQs will be there. I just solved the previous year MCQs.
Okay. So it is basically advantage that at that time there was no prep ladder marrow. So you were using a book.
That was the time when Tripladder or Marrow started doing their marketing
Yes,
and
exactly. Do you face any discrimination as an FMG doctors in hospital while practicing?
actually, there is no discrimination as such which I faced like until now. I did my internship from Osmania. I didn't face any discrimination. People were actually helpful. They helped me in times when I was not able to understand the Indian system. See, I studied from a Russian system. There will be some regional wise changes, no? My co-interns and my SRs and my professors, everyone helped me in learning. And right now, I'm working in an ICU setup. Here also, I have my seniors, like who PG graduates who are working as consultants or SRs in AIG hospital. I have few people who are FMG graduates themselves who did their PG from India. Everyone are actually useful, like helpful. They just
Okay,
make me feel more comfortable.
that's
Maybe
really nice
whoever
of
is
them.
saying they are facing discrimination, probably they are not working well, or they're really having so much lag in their academics. Like if you're good,
Okay,
if you're okay in your academics, it is easy to cope up with the Indian system.
okay, yeah. So next question is that you are planning for PLAB one and also you gave your OET exam. So how you are managing your time like, with hospital duties and your studies?
Okay, actually, to be frank, what I did was like I just took 7 days permission from my hospital and I prepared for OET. The thing is, people say we need 1 month, 2 months time for OET, but I am working in a private sector hospital where making clinical summaries, death summaries, transfer summaries is like common. So if you take OET, it has 4 parts: reading, writing, listening, and speaking. Speaking, like it's normal patient doctor conversation, like a every OPD department, like how we take patient history and what is the preliminary diagnosis and what treatment plan we are having discussing with the patient. It was fine. Reading and listening, I'm from CBSE background, so until my 12th standard, I had my same kind of English examination, so it was fine. Writing, people face difficulty in writing in OET, they said, but I felt it is fun. It was fun and it was more fine for me because I got used to making summaries. It is more like a referral letter or a discharge letter, which they call in
Okay.
UK. Here we call it as summaries. That's it and nothing else. If I think OET was fine for me. It was not so easy. I cleared it in my first attempt. I got A's and B's only, nothing less than that. And the PLAB one, I have applied for my PLAB one. Should take a break from work and prepare for it. It is in the
Okay.
upcoming year, February. So planning to prepare for it.
All the best for your PLAB exam. And why you gave
Thank you.
OET and not a IELTS? Firstly, what documents are needed for PLAB and how much it costs?
Okay, see, as until PLAB 2, you don't need any documents actually. Like I have applied for my PLAB 1. The GMC will check your documents only after clearing the PLAB 1 and PLAB 2 to get a GMC
Okay.
registration. So until that, you don't need any registration. That's why people during their last year of like 6th year of their medical school only, they give PLAB 1, and after internship they give PLAB 2. The criteria is You can give PLAB during your internship or after your, you can give it during the internship, but PLAB 2 should be given after internship. So that immediately
Okay.
after clearing PLAB 2, you should take General Medical Council registration using all the required document. And it is like a big process.
Okay. So how to get registered yourself for PLAB examination?
Okay, the thing is very complicated but simple. We have to just clear OET or IELTS with the desired
Okay.
grade which the GMC is asking. In case of OET, your grade should be B or above. In case of IELTS, in each session it should be above 7.0 and overall of 7.5 grade points you should be having. And you should upload this English language test proof certificates in the GMC site in your account. You should create an account and just upload in that, and they will. You should give them access to check your results with that respective OET or IELTS site. Okay. After verification, you'll be allowed to book a slot for PLAB 1, but they are releasing slot in a particular time, like particular number of seats in particular number of time. So before that, you should get everything ready so that once the date and time will be announced for that particular period when they'll be releasing the seats, you can be ready with your English proficiency test result.
Okay. Okay. So how much PLAB one costs to you?
Actually, PLAB one, it costed around 250 euros. Approximately, I
Okay.
paid 25,000 of INR. It might increase or decrease based on the euros rate and based on the conversion, all those things.
Mm-hmm. So your work experience as a doctor, the day you felt that it was all worth it.
The day it was all worth it. Probably my first internship was with it was OBG posting, obs and gynac. And the day first time, see, in Orenburg, we had clinical exposure, right? But in Orenburg,
Yeah.
it is like so systemic, like sisters work, sisters do, doctors work, doctors do. So we are not that much experts in keeping cannula and all. So during my gynec posting, when first time when I was able to secure a IV cannula peripheral line for a patient, I felt like wow. But actually, that is the work of a nurse.
Sister.
But still, I felt
Okay.
good. And during
Mm.
my surgery posting, I I did a surgery like I did it. I was the main surgeon, and my seniors were assistant to me. I did this hydrocele surgery, and I felt good. Like they said me just how to do verbally, and I did it
Mm.
myself. Same way, some cyst was there, spinal near the in the back, lower back region, uh, in lumbar region. Same way, my senior, she just said me how to approach it and how to excise it, and I did it myself. Like I felt like wow, I'm able to do, because I never saw
Okay.
those surgeries. Just verbal orders I followed and I did independently, and it was really good. If you work and if you do your internship in the government sector, every day you'll feel like you are the boss, you're the doctor, because India is
Okay.
having so much less doctor and so much more of population. Maximum people come to government because they don't have money or they don't have insurance like foreigners. In foreign, insurance
Mm-hmm.
is compulsory, but here it is not. So all rare, peculiar cases, all serious cases will come when you will all of a sudden intubate a case, put a central line, you will really feel good. And when those patients, attenders will come and hug you, touch your feet, cry, you will be like so much emotionally, you'll be like so much touched. Your heart will be touched. Like this is the thing why I did MBBS, to save lives. You'll have that feeling definitely. Every day, not one day, every day. But these three incidences, I just remember.
Oh, that's really great to hear. So next question is what platforms and material you are using for your PLAB preparations?
Okay, see, I am as of now using Plabable, Plabable and Plab keys. Plabable is an app which has like set of MCQs. We
Mm-hmm.
should keep solving it. Actually, what strategy I'm doing is Plab keys is like notes. I'm studying those notes and solving MCQs from Plabable. See, PLAB is an
Okay.
exam which has the same difficulty and same kind of pattern as that of FMGE. So as I prepared for FMG, I'm feeling it's an exam which is doable.
Okay. So is
So
there MCQs in PLAB 1 also? The MCQs exam.
yeah, PLAB 1 is a MCQ exam. PLAB 2 is like our sixth year we used to do stations, right? Stansia.
Mm-hmm. The.
Sorry, I think
Yeah,
you're not
exactly.
sixth year,
Sorry.
right? Okay, it is a
Mm.
stanza. Stations will be there. We used to
Mm.
have mannequins in Orenburg,
Yeah.
which have recorded murmurs and everything inside the mannequin. When you auscultate, you'll be able to hear the breath sounds, which is like way advanced. In UK, either mannequins will be there, or I think fake patients or real patients will be there. Dummy patients or real patients will be there.
Okay.
So it is same like our sixth year exam. We'll have a MCQ followed by stations. Same UK also MCQs followed by stations to get a final registration. So
Okay.
after this registration, as I cleared my FMG and completed my internship in India of 1 year, I can do directly the foundation year course two FY2 we call. I can apply for a job for FY2 level.
Okay. Okay. So next question is like is there negative marking in PLAB?
No, no, no. It is same like FMG. It is a like licensing exam, no? So any licensing exam will not have a negative marking. If you take USMLE step one also, no negative marking. Because writing those exams will give you a license to work as a doctor. If you take in case of
Okay.
NEET PG, it is a competitive exam. So it has negative marking. INICET is a competitive exam and it has negative marking. Any competitive exam, it has negative marking. Any licensing exam, it doesn't have a negative marking.
Okay. So who is your inspiration for your unhindered encouragement and towards your goals? Who kept you inspiring throughout your journey?
Actually, like not related to my profession, but I think my mom is my inspiration. Like she just thought like during her time what she couldn't conquer, she wanted me and my brother to conquer it. She did everything. She and my dad, they did everything they can do to just make me a doctor. And my brother, he's pursuing his PG in Germany to make him pursue his PG. He did sports medicine. We both are related,
Okay.
medical related persons only. He is doing now psychiatric medicine in sports. So she's my inspiration. She never gave up on us. Though the world said, why you want to spend money on a girl child, how you'll marry
Yeah.
her, why you didn't marry her. She just said, like, no, she's a doctor. She'll marry when she wants. Let her study until that, and she keeps supporting me. More than financially, I think emotional support is the thing which many people are not getting from their family. I know many people whose family gives them money, but emotionally they
Don't
are
give them emotion.
lagging behind. But my parents are cool. My mom, being a female from a totally different background, her family is like so orthodox and all, but she didn't. She made sure like I'm not facing such
Difficulties,
things in my life.
situations.
I should have I should have a memorable childhood, adolescent, and adulthood. So she is my inspiration. Like she's cool,
So,
the cool mom.
okay. So my last question is, what message you want to give to all the students who are planning for abroad and also those for who giving FMG 2024?
See, people who are planning for abroad, they'll obviously be like me. I gave during my time AAPMT, but BC reservation and all, I got only BDS seat, or few might get BDS, or few might get MBBS in some costly private college. Same like me, I face the same problem. I couldn't afford for it, to be frank. BDS in government, I was not ready to take. I didn't want to become a dentist, but that is also a profession.
So
So,
understandable.
what
Last,
what I want to tell to people who are coming abroad is either they come because of
last one.
low need scores, or they come because of like they were not able to secure a seat in India. So for either of them, I tell only one thing: just study for your university exams. Now we have so much sources, which is very good. Like we can avail one of the sources, we can take help of seniors, even they can contact me if they want any doubts, and everyone will help them, right from the app to the faculties to the seniors. Everyone will help them. They have a very good opportunity to
सिर्फ 1 मिनट बोलो.
make sure that they
Done.
have very good opportunity to make sure that their basics are very strong compared to me, my batch. Upcoming batches have more sources that they can be more good in their basics, which will help them clear their FMG or PLAB or whatever exam. Everything has the same subjects, same nerves, same artery, same organ, same failures, and same treatment options in every book. What no matter whatever the author is, whatever the app you're going to use, just try to study as much as possible. That's it.
Okay. Thank you so
For
much. Thank you for
PLAB,
being there. And yeah, you were saying something.
yeah.
Yeah.
No. I think I said everything. No, everything is done, right?
I thought I interrupted you.
No. I was about to ask like for PLAB also, it is same subjects only.
Okay.
Nothing like we should we should start something entirely new and all.
Differently. Okay, okay.
Mm.
So I was saying that thank you for your time. Thank you so much for being there. I know it was very difficult for you to manage. You were in the hospital, still you managed your time. So that, thank you so much for that.
Yeah, it's okay, fine. Thank you. Thank you
Thank you so
also.
much.